Well, welcome everyone to our podcast brought to you by 27 Degrees Consulting. This is the 27th Degree with Chris and Nancy. So we're really excited today. First of all, we're excited about our guest, Stephanie, who's going to talk to us about addiction. But beyond that, we've got so much other stuff going on that I just want to spend a minute talking to you about. First of all, you may notice we're back in the studio. This is very exciting. We tried our best to do this remotely without the studio because of COVID concerns, and it just didn't work out that well. We were reliant on internet speed of our guests and issues that we really couldn't control. So we're really happy to be back in this studio. We are all COVID vaccinated, so we are going without masks, which is another really exciting thing. And we've got some really great podcasts coming up, which I won't get into all of them, but there's some are just fun, some are really educational, some are both. And the next one is going to be on Medicare. And there's a lot of folks out there that are getting to that age range where they need to think about Medicare and the Medicare options. And we're going to have a Medicare expert who's going to talk about that. That's going to be April 9th. It's a Friday. We'll go back to Friday for next week. We may do some of our podcasts on Friday, some on Saturday. We'll let you know as time goes on. And then the last thing we're really super excited about is our new webpage. So our old webpage we're retiring. It really just didn't really meet the needs for the company. I think the new one it's really looking fabulous. We have a local web designer who's doing a very nice job with it, and it's going to really bring a lot of value to our customers and our viewers who use the webpage. So without further ado, I want to mention our sponsor, Bay Coast Bank. We're really proud to have them sponsor us. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.com or call 508-678-7641 to learn more. Bay Coast is great. They support educational events for the community. They're really a community-oriented bank, and that's one of the things we really love about having them as a sponsor. So now, without further ado, why don't you tell us a little bit about yourself?
Sure. So my name is Stephanie, and I am a social worker, and I primarily service the South Coast or Bristol County. And my main focus is I work with individuals who have a severe persistent mental illness, specializing with co-occurring disorders, which basically means they have a mental illness as well as some sort of struggle in the addiction arena.
Okay. And you also have a lot of experience in addiction with non-mentally ill persons too, it seems like.
Yes.
Also,
I do have a long history. I started my professional career working in an inpatient detox, and it's just kind of expanded over the last 10 years.
Okay, great.
So,
Nancy.
Oh, thank you. So, Steph, can you just tell us a little bit about what your typical client's like? I know you have said that you deal with dual diagnosis, so you're dealing with mental illness and substance abuse within that population. Mm-hmm. So, tell us a little bit about your clients in general.
I mean, it's not like one is. It's a wide range. We cast a wide net. I primarily work with adults. So there's a big, wide age difference. And we work with individuals who are in every, stage of recovery. So we can be working with them, right at the jump where they might be more in the contemplative, or pre-contemplative end of things where they might not be considering treatment or wanting to get any type of services. And then we can be working with individuals who are wanting to get some sort of treatment, and we can refer out. So we really just meet the needs of the individuals in every stage of their recovery.
Steph, when you talk about substance abuse, what kind of substance abuse are you primarily seeing now?
We see a wide range. It really depends on location and the population you serve. But we see anywhere from severe opioid addiction, anywhere from pills to using intravenously. We see a lot of sex addiction, a lot of gambling, and we also see alcoholism as well. So it's a wide range.
So it's really more than just substance abuse you deal with. You deal with other types of addictions.
Yep.
So that's interesting.
We're trying to typically try to stray away from the term substance abuse because we more like to not have that like title. So we do like address it as like co-occurring or like like multiple forms of addiction. Yep.
Are the treatment pathways the same for all like the types of addiction? Or they get? I know that sounds like a silly question, but I mean,
No silly
but do you?
questions.
So someone that has substance abuse with alcohol versus opioids versus any of the other types of addictions that you've noted, is it kind of the same pathway you set up for them? Like, how do they differ? Like, if I'm, if I'm drawn to one substance over the other, and Chris chooses another substance, like, what's the main difference between?
Yeah, maybe we
this?
can talk about, say I'm a typical client. I come in and I have a problem with, let's say, prescription opioids. How would you address, what would be the process I would go through as I go through your program?
Sure. So typically we like to utilize what's called like evidence-based treatment practices. And one of the main ones that we use is like brief screening and intervention and then referral to treatment. So no matter the individual that comes in, we'll like briefly like kind of screen them and assess them, and then depending on like their individual circumstances, we'll refer out to whatever services or treatment will best fit their needs at that time, but also like what the individual is willing to do, because they might not be willing to work on like certain aspects of their recovery. So we just try to meet them where they're at. But to address like the point that was brought up earlier about like pathways to recovery, there's not just one. We like to it's actually like a term, and we have like a lot of treatment trainings around this. Not treatment trainings, but a lot of specific trainings around this called multiple pathways to recovery, because even if like an individual has maybe, let's just say, like had an alcohol problem or like concerns with alcohol over the last 10 years, and we see two individuals with like similar treatment patterns, they might not want, it's all about what the individual like is wanting at that time or what they're willing to do. So the two paths that they can go down like can look completely different, even though like their past could be similar or their symptoms could be similar. So we really like to encourage multiple pathways of recovery, because an individual could go to Alcoholics Anonymous or AA meetings and really benefit from that. And then we see other individuals who don't necessarily like to go to meetings and might need like inpatient treatment. It's really
individualized.
Depends. Yep, it's so individualized. Yes.
So Steph, like just staying on the alcoholism realm, I guess. So you've mentioned a couple of different treatment options. Do you like how is that conversation with the client? I mean, do you say this is what we have available? Is there anything resonating with you? Have you tried this before? Or do you look at their history too and say, we've done this X amount of times, maybe we can try something new?
Yes, absolutely. So it depends what type of individual is working with them too. The program I work for, we have like multiple different individuals that service or I'll provide substance use services, from recovery coaches, which is more like a peer-to-peer service, right up to like a licensed alcohol and drug counselor, so they can provide more like the clinical end of things. But I forgot your question.
No, I was just saying, like, as they move through the treatment program, how do you guide them if something hasn't worked before? Maybe they're like, oh, but this is my comfort zone. I like them. I know them. I want to go back to them. But it's like maybe the seventh time we've gone down this route. So what's that conversation like?
Well, it's important to note that the program I work for is not a treatment program. Like we provide like intensive community-based support. And then we have like employees that specialize in so many different areas depending on their needs when we'll bring them in. But for somebody that's like I really like to use the stages of change. So there's 5 different stages of change, going from pre-contemplative, contemplative, preparation, action, and then maintenance. In a shorthand way to remember that is PCPAM. So depending on where they're at in the stages of change, there's different like motivational techniques that we can use, and also like treatment suggestions in each stage of change. So if they're pre-contemplative, it's more planting seeds and having like some psychoed around that. If they're contemplative, like moving along the stage, maybe we'll introduce them to meetings or something like that's maybe low impact. And then preparation will be going over different forms of treatment or services that are available, and we can make suggestions as to what we think would be most helpful to them at the time, or just lay out options, and then they can utilize whatever option they would feel is best for them. The action stage is when we implement that like service, and then the maintenance would be the individual like maintaining like whatever routine or like treatment service that they have like encompassed in their life.
Okay.
So suppose someone's stuck in one of the stages. How does that happen frequently? And like, do you have like a timeline in your head that's like, come on, we have to kind of move you along. You have to go to the next stage, or is it truly you would use the phrase, you have to meet them where they're at?
Yeah, you have to meet them where they're at. I've seen individuals stuck in pre-contemplation for years, and then overnight it seemed to sort of like change. But it's because like even if like they're not willing to like go to treatment or whatever the case may be, we're still there as like a constant support and placing like that. Like just planting those seeds, like, hey, this might be helpful, or like this might be like we really like to utilize harm reduction too. So we encompass the idea that if we have individuals like in active use or struggling with substance use or any form of addiction, like we recognize that they're going to maybe continue down like some destructive behavior or things like that. And so we like to encourage like, hey, like we know that you're going to be engaging in these behaviors. This is a safer way to do it. Okay. And whenever you're ready to like maybe make the next like changes, we'll be here to support you in that way.
You're meeting them on where they're at, and that builds some trust, I would guess.
Yep.
Because you're willing to do that.
Yeah.
Does everyone come to you voluntarily, or are there people who the court says you need to be in this type of a program, and do they get to you that way?
Yes. So the program I specifically work for right now, it's a private referral system. So it's not open to just anybody. But the agency I work for, we have many different contracts that offer many different services around like the South Coast area. So it really depends. We do have some court-ordered programs, but because like we're a vendored program, there's times where it gets kicked back up to leadership. And if we believe that they are at like their life is an absolute imminent risk, like we are social workers, and we do like sometimes like implement sections, either for mental health or substance use. And then like the court will decide if like treatment is necessary or not. That's absolute last resort. But that's if like everything, we've exhausted like every option, and we feel that like their life could be at imminent risk. I've seen it happen like usually after multiple like overdoses, driving under the influence multiple times, just really like life destructive behaviors that could hurt them or somebody else.
Okay.
Steph, when you see clients and when you're dealing with clients, do you have resources that you like that are your go-to, and can you kind of talk about what community resources there are and like who plays in your network and how you get these clients to the programs and to the supports that they need?
We are huge with like community involvement. Our program, we like to not have it be like a forever option. We're always like encouraging our individuals to integrate into the community in the event they don't have like our support anymore, they can rely on services within the community. So we build a lot of relationships that are community based. And that before like pre-COVID, we were boots on the ground going to certain agencies like, hey, like this is what like we do. And we actually like built like a huge like 3-ring binder of services in the area. But yes, because we're more community-based, we have to refer out. And so if an individual needs inpatient treatment, we do have like the resources and relationships with other like detoxes or inpatient facilities in the area. And it's all like communication building. It is due in large part to our staff and like their previous employment histories and maintaining those good relationships and good communication patterns. A lot of it is contingent upon services can be contingent upon insurance. So we see that as a barrier. What our main goal has been over the last several years is some facilities that specialized like solely in substance use can see like one of our individuals who have like a persistent mental illness and maybe like a suicidal past and can be maybe like a little wary about taking those individuals. So or like individuals that are on some heavy duty medications. So we try to just converse with them like, hey, like, you know, we address the mental health side of things and support them through that, but they really need like some help with substance use and they're willing to go. Like, can we just have a conversation to like break down those barriers so they can get the treatment that they need?
So, Steph, like the people that may be listening now that are struggling with substance abuse and they don't have, you said you're more on the private side with referrals and stuff. What can they do today? Like, what are some of the resources out there that maybe someone just listening to this podcast is like, all right, maybe I want to take some action. Like, who can they reach out to right now?
They can. So we love to utilize the hotlines, especially for individuals who might not have a lot of community-based support. So going through like SAMHSA or the substance use hotlines, you can research like community-based meetings, either like through Alcoholics Anonymous, Narcotics Anonymous, like Gamblers Anonymous, whatever your vice may be. There's meetings all around, and maybe just stepping into a meeting or even virtual. They're mostly virtual right now. So that has been, we've actually seen like since COVID started, a lot of meetings went virtual and we see a great amount of attendance because some individuals might be a little hesitant to go in person and sit and share when they're just starting their recovery journey. There are local, you can research like local substance use facilities, detoxes, things like that. If it's to that point where you need inpatient treatment, and they're willing to guide. We always love to, I don't know if I can name drop, but we really use STAR, which is in Fall River. They've been so helpful to us and they provide such a wide variety of services. And you can go there in person. They'll do an intake with you and set you up with resources that will like meet your needs at that time, because if you're going for an intake, you're willing to get some sort of treatment and they'll refer you to a place like that. So they've been so helpful to us and our individuals. So like they're the number one place that we recommend.
We use STAR quite a bit. So the other thing is they can go to their physician too, and you know, their physician may have resources and they'll probably end up referring them to an organization like STAR, which is what I often end up doing.
Yeah,
so
definitely.
That's another resource for those who have a relationship with a primary care provider. So you brought up COVID, and I'm really interested in this. So this must have changed your work experience quite a bit. Has it been more difficult for people? And I only ask this because you mentioned that now there's more people on meetings where before they may be hesitant to be there in person. How has that affected your ability to do your work, and how's it affected patients who have these concerns and these issues in regards to getting treatment?
As social workers and community-based like even direct care workers, like we value the presence of being with an individual. And so we mostly have seen our clients when it's safe to do so and like maintain social distancing, things like that. A lot of our clients, we've seen them struggle just due to not having like their constant support physically being there. So we've brainstormed other ways to do it, whether it's FaceTime, things like that. Our program specifically has mostly seen clients like throughout the duration of COVID, like practicing like safe COVID precautions. In regards to meetings, yes, that has changed. Some individuals don't like the virtual route. They prefer like being in person. Some people do like the virtual route. And so we have like come up with like virtual meetings that take place 7 days a week, or 7 meetings a week, 5 days a week. And we've seen like great consistent attendance with that. And if they aren't interested in like the meeting like we have to offer, like we will present options as well. to other meetings that they might be interested in.
Okay.
You know, that's funny because, COVID has been such a challenge,
Right.
but there are positive things that have come out of here. This
Yep.
is now a totally different option that people may not have had that they resonate with and they're going to do better with.
Yep.
Can you talk a little bit? Do you have, when you're dealing with a client, how does their family work into the picture? And do you offer support for families? And what are some of the most important, I'm giving you a complex question here, but what
A
are
lot of
some,
compounding questions.
I know. I get so excited when I think of things. I'm just going to throw everything at you all at once. So, what are some of the things that families can? Don't comment.
I'm not commenting. I'm just,
What are some of the things that families can do to be supportive? Because they're in a tough spot too. They want to see their loved one get better, but there's just such a challenge in place.
We love to embrace the families, and we do have family specialists that help. Maybe sometimes relationships can be a little more dynamic and complex due to some mental health concerns and substance use concerns and related behaviors and challenges. So we really work with the family to try to provide as much support to the individual as possible, maintain those relationships, because really it's so huge. And we empathize with the family, and addiction is, it's not just a disease on the individual. It really impacts the whole family.
That's a great point.
And we recognize that, and we, as much as the family is willing to do so, try to keep the family in the loop or as involved as possible, so we can provide the necessary support to them as well.
Yeah. So, working in this field, you've seen obviously some real successes. I've seen some successes in my field as a physician. I think, a lot of people who are out in the community who aren't involved with addiction feel like there's not much you can do. People are always going to have these issues, but we know that's not true. So tell us about maybe a success story you've had, without obviously using any identifying information.
No,
it's
of
hard,
course.
but I think it'd be great for our viewers to know that, these things work and that people get better.
Yep. It really, I have seen, there was a story that, and I don't like to admit it, but I was working with an individual for a very long time, and to the point where I was getting very burnt out. We went down almost every single sort treatment option available. And I was like, there's no way. I was like, I don't think this is, I probably just have to start thinking about hey, this might not work.
Right.
And then it almost just seemed overnight that this individual ended up getting, by the skin of their teeth, got into a halfway house, which is a long-term residential program, and did wonderful. It took 6 months, and then she got her children back, her apartment back, everything, and just did so wonderful. And this individual was overdosing multiple times a week, and it was just because sometimes you do have to accept as a service provider that we're not always going to see success stories. There's going to be some tragedies and things like that, but I liked that learning. It was a learning experience for me, because there was a point where I became so hopeless for this individual, and that really made me change. And I'm so grateful for it, because she was able to overcome so many trials and tribulations and barriers and everything you can think of that we went through together. And for her to reach insurmountable success it was amazing to witness that, and it was such a privilege to be a part of her journey. But I was so hard on myself after that, because there was a point where I was just this isn't going to happen. You just accept it. And but at the end of the day, I was like, okay, well, I've seen the worst of the worst and the best of the best, and that just really resonated with me, that you have to have hope, because no matter what the situation, how dire it may be, individuals can really come out the other side. And that was, I'm so grateful for that experience, because it really, I think, made me become a better social worker.
Yeah, we've all seen these stories where, personally we may have dealt with in your field and mine, where you have people who have just tried and tried and tried multiple times, and then for whatever reason, trial
Something
9,
just clicks.
they're able to basically get through where they need to get through, and then they have their lives go in a more positive direction. So.
And it's important to note too that when dealing with or working in like behavioral health services, relapse is almost always part of the story. Unfortunately, there are times where individuals can like go to treatment once and be great.
Sure.
But more or less studies do show that relapse is going to be a part of like the recovery journey.
Yeah.
So, we prepare for that, we plan for that, and support our folks and their families and loved ones throughout the process.
I have a few patients in my practice that have alcohol issues who, they're alcoholics and it's really affected their lives adversely. Couple are homeless or, they can't have gainful employment, whatever it may be. It's affected their relationships, their marriages, their families, and they don't really want to do anything about it. So as a physician, I have a tough time really figuring out what to do about that. It's hard to deal with that, because you want to be able to help people. It's part of why we go into this profession. You see that, I'm sure, here and there. What do you do when you're in that situation?
Alcoholism is, it's just more of a personal belief. It might not be scientifically backed, but I believe it's one of the more challenging addictions to overcome. Alcoholism typically is developed over a long period of time, so it becomes so habitual and part of like day-to-day life that it can be really hard to imagine a life without it once you have had it for 10, 15, 20 plus years. And that's when it typically can become problematic. Alcohol is so advertised and it's part of American culture, and we're proud to have it as our American culture. And it makes it one of the more difficult addictions to really address and treat, because you're trying to not erase, but treat like years and years and years of, and you might not be dependent on the substance, but it gradually builds, because alcohol is one of those substances where you build a tolerance to it. So over time, I almost call it like a second blood. You can't not have it once you're dependent on it. Like it becomes medically such a significant issue if you were to just like go cold turkey and not drink anymore. So there is a really big dependent factor to it. So if you have an individual coming into your office and they're having they have abused alcohol or used alcohol for like an X amount of years, and it's important to know if they're maybe using it in excess or they're dependent on the substance, because that would really mean like what intervention is medically necessary at that point. A is such like an invaluable resource and has really the community aspect of it is what makes individuals like maybe considering a life without alcohol more hopeful that they can, because other people have done it.
Sure.
But sometimes it can mean that you are going to need maybe a little bit of long-term treatment.
Yeah.
Because it's not just like the physical dependency, it's also the mental dependency that has been developed over years and years and years.
Well, it's everywhere. I mean, it's like, and it becomes part of the social experience. You know, you go to a restaurant or whatnot, and the first thing that a lot of people do is they order their beverage, their cocktail before they have their meal, and it just becomes part of kind of the normal. It becomes a part of your life that is it's interesting.
Yep. And if you're not drinking, people question it, and so there is like a pressure aspect to it.
There definitely is. I mean, if you're not drinking, people assume you had a problem with alcohol or you're pregnant, one of the two. So.
Yeah, exactly. That's very true.
Very true. Yeah, it's just an interesting issue. So I see a lot, and I do see these folks here and there who just really. They don't want to give it up, or they're not ready, or they can't really envision a world without it, I guess. Maybe that's the better way to put it. So, yeah.
Steph, you had said a few interesting things, but one of the things
She said a lot of interesting things.
She did. So I had a couple of follow-up questions for you, too. You talked about the stages and the pre-contemplative and the contemplative. How do the families cope with that? I mean, they see someone and they might not have that same patience, and they're like,
True.
"Oh, you're pre-contemplative. I'm just going to let this
No.
go for years," you know.
I
you
know.
know, like, like, you know what I mean? And it's tough because they're going through this as well.
Yep.
So how do they set up boundaries that still align with those phases?
Oh, it's the family system is it's fascinating. The biggest thing we see in the family system is enabling behaviors. And it's hard because it's a family member going through something,
Right.
and sometimes you just want to avoid conflict and
Sure.
not address an issue. Or like you're providing all this support or doing what you feel is right. And it's exhausting, and you're getting some compassion fatigue, and so patience can like wear thin, especially if it's within the household. And also, I feel like some individuals can like become numb from seeing their family member like destroy like their lives, so to speak, or whatever like the perception is. But there is support for families out there. We like to utilize STAR too. They do have a family intervention where they encompass the whole family, and like address whatever the family's going through, their related emotions, feelings. And there is support groups such as like Al-Anon and things like that for family members, or like adult children of alcoholics. Like that's great too, where they can find a support system, work on if they have like enabling behaviors, things like that. It's all about psychoed, because some individuals might not know anything about addiction or alcoholism, especially within the family. And the individual who is using the substance might not know a lot about it either. So it's all about education, providing like the right resources, and just supporting the family through it. There's not like one way fits all kind of thing, or one size fits all. But the more support you have, the more education you have, the more research you can do, would be great. It's great. You know, it's the individual who's struggling. If they have a family and support system, they're already so lucky, and like blessed to have that. And those family members are really in such a great position where they can like provide support and the necessary resources if they haven't like gotten to that stage where they are maybe like compassion fatigued or burned out.
So,
I'm not going to interrupt you. Go ahead.
all right. So, as a physician, so I see this frequently. I'll see people who were successful in their journey to get past an alcohol addiction or an opioid addiction. And a lot of what they tell me is that one of the things they had to do, I think particularly with opioids, but maybe with alcohol too, is they changed their circle of connections. So, if someone is in a group where everyone it's the norm to use opioids, for example, and they kind of support each other in that habit, they break away, and it's a hard thing to do. But sometimes I see people who have codependent relationships. They're married to someone who is an alcoholic. They're both alcoholics, or they both abuse drugs. How do you deal with that? I mean, if one person is ready to try to change their life, the other one doesn't want to change their life. How does that work out? That must be another layer of complexity.
Yeah. Especially if individuals are using and drinking together. It's a complex dynamic to address, and that's more on the professional end of things. Individual therapy is a great thing, or even couples therapy, to address maybe some of the root concerns that might be going on, or why one individual wants to work on their recovery and the other one doesn't. Codependency really runs deep, and there's a lot of complex factors that like compound multiple different issues.
Right.
And it can be hard for somebody who's maybe not specialized in that area to like kind of treat that, because you're not just but you're not just working with one individual, you're working with two, so it adds a lot more layers. So if they're willing to go to some type of like individual therapy, that's something I love to recommend. And that's it's a great resource if they're willing to go through it. But yes, it can be really hard. I've seen a lot of couples have like that codependent relationship, and their children have had to be like given to the state, things like that. And
Terrible
even
things.
sometimes it's not. That's not enough of a wake-up call. They might need to like go down that self-destructive path for a little while longer. but it can be very difficult to break away from like your group of friends that you have known and maybe like used with, things like that. But it really is about changing your entire life and the people you associate with. And it can it can lead to relapse because there can be like reminders, or I don't know if like you like to use the word triggers, or like constant like reminders and triggers all around you, which can be very difficult and challenging when you're wanting to make a life change.
Steph, you mentioned relapse before, and that's normal to see, certainly, even a number of relapses. How do you stop someone from just beating themselves up? Because someone who like really does want to stop and has good intentions, but it's tough. It's it's challenging. So how do you keep a client motivated after they have X amount of failures?
Yeah. Well, if an individual is like went to go get help, they went to treatment, maybe let's just say for like maybe 3 weeks to a month or so, and they're going right back home. They're mentally so flooded with reminders and everything else. Having that constant support, we love to recommend meetings, so you have that like community-based support, even sponsorship. So having somebody go through like the 12 steps and the 12 traditions with you, it's such a huge help when you're going back home, like after treatment, and trying to navigate a very new world of recovery. Because once you think of it, like this individual, they changed their whole life around, which is completely respectful. But to expect to just like kind of muddle through it without any source of support, it can happen. But to have that like support, those people around you, building like a recovery foundation is so essential to prevent relapse.
I think too, we've mentioned AA a couple of times now, and it's such a safe place for people with addictions to go. They're with a group of people that get where they're coming from, where, some people, even if they're very supportive, a husband or a daughter, they just, if they haven't been through it themselves, there's something to that they can be as supportive as they want. But, it's nice to have a group that gets where you're coming from, you're totally safe with. And if you mess up, there's no judgment there, so it's, I would totally second that statement that it's, the meetings are great.
So I was going to ask a question and that just about the frequency of all this. I mean, it seems to me, and maybe I'm wrong, and I haven't looked at the statistics, that there just seems to be more and more people who have addiction issues, whether it be alcohol or drugs or other. Is that the case? And why do you think that is on a societal level, if that is the case? What's going on?
I think that's a great point you bring up, but the first thing that came to mind is I think there's more awareness. And there's more treatment and supports available. And like specifically in Massachusetts, I mean, like the Governor Baker several years ago started a campaign to like end the stigma of substance use and addiction and like mental health and things like that. So I think due to that, individuals are more open and like maybe less scared, less inhibited to go seek treatment and seek help. So I think there's maybe a little bit more awareness to the issue where, and there's more services available where we can address it. That being said, I mean, that's maybe like in regards to alcoholism and other forms of addiction. Definitely with opioids, there's been such a huge, dramatic, unfortunate increase over the last 7 to 10 years that like statistics back that up. And I worked in inpatient treatment right when the opiate epidemic started, and we were just like, I don't want to say deers in headlights, but we were just like, what is happening? People were coming in, and at the time fentanyl wasn't even on our panel because why would it be? And people were coming in active opiate withdrawal and not testing positive for heroin. And it took like several months for local hospitals and detoxes to get fentanyl on the panel, and heroin isn't even coming up on like the drug panels anymore. But yes, the opiate epidemic is very real. It increased like insurmountable, and we do a lot of trainings regarding that with stats behind it. we love to adopt harm reduction and Narcan training because it's a very real threat specifically to our region, just due to like the ports being so close to us. Fentanyl is very easy and cheap to acquire, and it's extremely potent and addictive. So the more awareness we have around it, the more we can really do to address it and prevent fatal overdoses. Stats show that that fatal overdoses have decreased ever so slightly over the last couple of years, and that's directly due to Narcan and overdose prevention techniques, community-based opiate task force, things like that. It's a primary threat to New England right now is the opiate overdose epidemic. And it's very real just because it might not be in the news as much as it was several years ago. It's still such a huge threat to our area, but Narcan is really the number one reason why overdoses are maybe tapering off and decreasing slightly.
That's a great point. Yeah, I mean, if there's anyone out there who's using opioids, whether they be, through a doctor who's prescribing them for a legitimate medical issue, or you're using them in another way, you should have Narcan around. It's really important. How do people get Narcan? I know the answer to this, but I'm going to throw it out to you.
It depends. So it depends what area you are from, and there's multiple ways to get it. So for the Taunton, Attleboro, New Bedford, Fall River, all like Bristol County, South Coast area, Seven Hills Behavioral Health gives out Narcan for free. And if you have to use it or it expires, you lose it, whatever, they'll replace it for you. So they'll give you 2 doses. I recommend everybody have Narcan on them. You never know what you're going to be walking into. Seven Hills is a training facility, so they will also inform you of how to recognize the signs of an overdose and how to administer Narcan. If it's something that's new to you. But Seven Hills is the main supplier for this region, and they're located all over the place. I can link you if you want.
Yeah, we can put some links on the on the webpage.
I think we'll definitely have some links on our social media sites.
Okay, I can definitely send that over.
People may have questions about where they want to get in touch with.
You can also go to the pharmacy, but I know they might charge you. I think you can get waived for the first time, but individuals have seen a charge, but you can get Narcan for free. Especially if if you're an individual that uses, or you want like a close family member to have it. You can't Narcan yourself, so it's good to have the people around there.
Right, yeah. That would be hard to do.
Steph, before we start wrapping up, I just want to touch again on something of importance that you had mentioned. You had mentioned that you were kind of getting to a place where you were starting to feel burned out with one particular client. So people that do work in healthcare, nurses, docs, techs, when they see the same people maybe coming in again and again and again, and you talked about stigma and trying, you sound so non-judgmental, but there, what kind of conversations do you have with like a healthcare team who's so exposed to this and maybe having a loss of sensitivity towards this population? I can
definitely empathize and understand maybe where the loss of compassion, if it exists, comes from. You're seeing, especially if you're in an emergency room or you're the first point of intervention in like a healthcare facility. You're seeing an individual at their absolute worst and lowest point, so they're not going to be happy to see you. And especially if they're coming out of an overdose situation, they could possibly be irritable or aggressive. So you're seeing these individuals at their absolute worst. But I've had an individual go through the ER, maybe hundreds of times in 1 year, and it took, I think it was like the 200th time that they went to the ER and to detox following that, it just snapped and they kind of had like a little bit of a wake up call. They were homeless, but they were able to acquire an apartment because they gained a little bit of sobriety and things like that. So you literally never know when an individual is ready to change. It could take the 100th time they've overdosed, or the 100th time they've been Narcaned, things like that. So it's you
have to
always
address it
have
every
to have
time.
hope.
Yeah, and it's like more
Always.
to the point that if you're out there caring for these patients, this could be the time.
Yep.
Right.
After hundreds of times of seeing them, that what you say or what you do or how you treat them,
And
or
you took
something will
an
click.
oath, like when you became a healthcare worker, an emergency room nurse, things like that, to help people. If you're working in an emergency room or a hospital in the New England area, substance use is probably one of the top 3 things you're gonna treat medically. So there has to be some form of acceptance that this is going to be a primary population you're going to be working with and assisting with, and you never know when it's going to be. But you took an oath that no matter like what circumstance, the reason why you went into this is to save lives and to help people. And so we can't have that stigma or that like prejudgmental, like, oh, like they use drugs, they must be like not a great person or things like that. You never know. They're a human being that might be somebody's like daughter. They might be somebody's mother, like whatever the case may be. But yes, I can understand where the compassion fatigue will come from just due to the amount of behaviors they might see, but you never know.
And if you're in the healthcare field and you're feeling that burnout, there's lots of resources to get help.
Yes, you have
basically.
to, if you are feeling some type of compassion fatigue or burnout, it is your responsibility to go and seek some sort of like support and assistance with that.
And there's
points.
lots out there to help out. I know we're going to wrap up soon, but I just want to ask a couple questions really quickly if we have a few minutes. I'm seeing a lot of people with gambling addictions more and more. That seems to be, there's more of that I see lately. And the sex addiction I don't see as much, but I'll see it here and there, where people really have destructive behaviors and risky behaviors. And if you can just maybe speak a moment or two on those two topics.
So I've seen gambling addiction. I don't see it a whole lot. One of the resources that we use for maybe like vices or addictions that like don't require like a medical detox. We really encourage support meetings, number one thing, and individual therapy, of course, or some type of like outpatient support. There are programs that you can go to that might be like a day program like in nature or something like that. But that's all. They're not abundant around us. You might have to do a little bit of research to find what like insurance carrier will accept, things like that. But there's always support meetings, and you can talk to like your primary care physician for resources, or I know some PCP offices have like a social worker like in the office. So if that's a concern, they can talk to the social worker. Social workers, like we're like a referral source. So if we can't provide like a specific like intervention or treatment, we refer out. And so we find those resources to help our individuals go through or get the help that they need.
Excellent. Thank you.
Steph, last thing, as we wrap up, is there something you want to leave our viewers with, some message?
I mean, I think I like to say this, but there is going to be a point in our lives where we are going to face either some sort of mental health concerns or know somebody that's going through a mental health concerns or even like a substance use concern. And it's very rare that we don't experience that either firsthand or secondhand with our family or friends or close loved ones. But it's important to know that support or being by that person's side can mean the difference between life and death. And that's not dramatic in any sense of the imagination. But yes, there are resources out there that you can utilize. You don't have to go through this alone. And if it's something that you are struggling with, please reach out or research like local resources in your area or local meetings, treatment facilities, whatever the case may be. This is something that you don't have to muddle through alone. And there's tons of support out there and access to treatment.
And we'll list some resources on the
Sure.
webpage and whatnot, so people have that on our Facebook and Instagram, so it'll be there. So, Nancy, anything else you want to wrap up with?
No, I think it was a great conversation and one that was much needed for our community. Thank you so much,
Absolutely.
Steph.
Yeah, anytime.
I
Thank
wanna
you for
really-
inviting me.
Oh, it's been wonderful. Thank you very much. You really provided a lot of great information and insight to our watchers. And I want to once again recognize our sponsor, Bay Coast Bank, which is just a great financial institution. It's right for all of your financial needs. Visit baycoastbank.com or call 508-678-7641 to learn more. Thank you very much. Everyone, we'll see you back in a couple weeks for our next podcast, which will be on how to navigate through Medicare, which I think is an interesting topic. It's a complex one. We'll have a Medicare specialist there. And then the one after that, I'm not even going to say. It's just going to be so much fun.
It's a surprise.
It's going to be so much fun. I can't wait for that
I
one.
know, me too.
All right. Very good. All right. Well, thank you, everyone, and have a great day. Once again, this is a 27 Degree with Chris and Nancy from 27 Degrees Consulting. Stephanie, thank you very much.
Thank you.